to Australia. There is also a view across the National Cabinet that they are all effectively moving to a charging system for the hotel quarantine that is in place for those returning visitors.
Mary-Louise McLaws is an advisor to the World Health Organization based in Sydney, and she joins me live now. Great to have you on the programme. Australia's government is limiting the number of citizens by 50% of those returning. Will that actually reduce case numbers, and do you think it's a disproportionate decision?
Let me explain. Since the beginning of keeping records, so since early April, the numbers who have been returning have represented in the 60% of all cases around Australia. We're at about 9,360 cases, and in April we had about 66% of all cases in April were COVID positive return travellers. That was 3,700. It then went up to 4,000, 4,500, and very soon it's 5,000. So, of course, every single return traveller needs to stay in a hotel for 14 days. I can only imagine that our government has wanted to encourage people to come back sooner than later, because as they're coming back later, the number of return travellers are increasing their risk of being positive. And we've seen in Melbourne an increased risk that poses to the hotel staff where they're staying, because we don't have a purpose-built facility for return travellers.
And is charging for quarantine fair, would you say?
No. Just as an epidemiologist who has expertise in an outbreak, I don't think it's reasonable. Putting people in quarantine helps the rest of the community, and of course we have an obligation to our citizens and our residents to care for them. So I understand that this is a financial impost, but I can't see that it's ethical or reasonable. So I'm not sure whether or not this will be accepted across all states and territories.
And what do you make of the way Melbourne's 5 million citizens have been shut down, some of them without even much warning?
Yes, look, like a lot of countries, Australia is learning how to handle a pandemic, and sometimes they forget to care for our multicultural groups that come into Australia with either minimum amount of English and also potentially a reduction in literacy in their first language. So there was an assumption that, of course, everybody was understanding the public health warnings. However, in this particular very high-rise public housing, and usually for our migrant population, they don't necessarily or didn't hear the message. But it's a bit more complicated than that. It looks as if the outbreak in these family clusters, and there are several important family clusters, have a lot of interconnection, but also potentially an interconnection with the staff in the hotel, the quarantine hotel. And when those staff got infected, then it went into the community through this hyper-connected large families that share, meals and social times. So it's a very unpleasant lockdown, but I have to say that every single one of them has been unbelievably cooperative. They've all had testing, they haven't refused, and now that they've coped with the suddenness, because they didn't hear about it from their imams or their social leaders, so they have coped really well. So we have to be very admiring of their understanding. They haven't been able to leave for 5 days or more.
Mary-Louise McLaws, advisor to the WHO, thank you so much for your analysis.